take your pain away, and then help package you up and take you to the hospital. You okay with that, sir?
Yeah.
Okay. By the way, my name is George. This is my partner, Alicia. Okay, so we're going to help you, all right? So, Alicia, can you do inline manual stabilization? Okay. All right, so cutting the pants off. Oh, you have a zipper. Okay, let me just...
Hope you washed your feet this morning.
Yeah. Say, it's smelly outside food. Yeah. Depends on the person.
Last night.
Let me just expose this. All right. So, sir, I'm just feeling your pulses in your foot. Okay, you have some pulses. Sir, can you wiggle your toes for me? Excellent. Hold on, sir. Can you tell me what toe I'm touching?
The fifth one, the little toe.
Okay. All right. So, sir, you have your pulses are good and your nervous system is good all the way down to your feet. All right. So I'm looking at your leg here, and I see a closed femur fracture. And if it was open, I would irrigate it with a liter of normal saline, put some towels around it to absorb it all, and I would dress it with any abrasions or lacerations with dressings and bandages. Sorry. Good life. Okay, sirs, I'll just tell you each step of the way what we're doing. Just put your arm on your chest, please. Okay, let me just find your hip bone. Okay, sir, can you do me a favor with your left hand? Put your hand in your pocket and just move your genitals to the opposite side, because I'm going to put this strap across your inner thigh. Okay, you can feel the strap moving?
Ask the patient to do
Let
that.
me know
Yeah.
when you're up to there.
You like that?
Don't want to keep straight face.
Okay, I'm gonna tighten it. You okay there?
Yeah.
Yeah, told a bloke. His head's just swim. Oh, that's like what yours
Okay, let me get around the ankle.
Maybe.
Got a broken femur.
Go back and laugh.
Picking on me.
It's your hand in your pocket. You can't bring it in your pocket, that's a bit sad, mate.
I don't think you need to have your hand there any longer, mate.
You let go now. You can let go now. It's quite hard to get through you.
Ready for minimal traction?
Pain relief.
Okay, sir, we're just gonna pull a little traction on here for you, just a little bit.
It's a new term for anesthesia. Always used for posturing. That's what that is.
Thank you. Sir, how you doing?
Good, thank you.
Okay. We've got 2 straps on, we got 2 more to go. Okay, this is the last one. Okay. For the final traction. Okay, I'm just going to pull on some traction, sir. Can you tell me how you feel?
Yeah, that's good.
Pain relief?
Oh, it's gone.
Okay.
I'm gonna assume he's got something like in the happy pain. Oh, just keep going.
Okay. So, sir, I'm just going to reassess you. I have pulses in your foot. Can you wiggle your toes for me, please? Thank you, sir. Can you tell me what toe I'm touching?
The first one, the big toe.
Okay. All right. So you're properly immobilized now. I would consider maybe a vac mat, depending on the forces that sustained his femur fracture. So that's just an option. Okay, and then we will move him to the hospital. Okay. Good?
I'm happy.
All right. Next.
Alicia, do you want some hand sanitizer? Only because I'm not the person that likes to touch feet, so I have to sanitize straight after.
Some up,
We'll
some up
just
some
pop
up on
over
the
there, that's why I was
table
getting
there. They're not saying that your feet are, you know, like in any way.
Do you want to have
Smelly.
a feel as well?
You look like you were doing all right by yourself. Didn't look like you needed a hand at all.
They're all nice and powdered.
Oh, they've got fluff all over him.
Do you want to put your shoe on, or well, actually for the third one?
I won't do it after.
Yeah. Maybe. How about just a sock? Yeah.
Right.
This way it won't run out of time. Which we've already run out of. Thank you, Alicia, for volunteering. And please make yourself, do me a favor.
Yeah, we're taking it.
Okay. Ready? Ready. So we've got PPE on and the scene is safe.
Yep, I'm happy.
Okay. Hi, Alicia. I'm George. This is David, my partner. We see that you have a fractured femur. Wow. We're really sorry to hear that, but we've come to help you. And we've got a traction splint that we can apply, and that will give you some pain relief and then help package you up to take you to the hospital. You okay with that?
Yep.
Fantastic. So we'll just get to work, okay? You can give me some manual stabilization, please. Okay, so guys, so Dave's going to apply some manual stabilization, and that basically, what we want to do is to prevent any further movement of the injured leg, okay? As I apply the traction splint, David's going to help by, lifting the leg up a little bit or moving to the side, just controlling the limb, okay? Next thing I'm going to do is I'm going to take a scissor and I'm going to cut straight up to the belt line, and that allows me to expose that limb with just one cut, okay? Straight up, and then that's exposed. Obviously, we leave the underwear on, right, to protect the patient's modesty. We don't need to see what's underneath that. We just need to get the trousers, okay? Next thing we need to do is get the shoes off. Does she have a zipper? Awesome. My kind of patient. Okay. Oh, thank you.
Is that going to be your expectation now, George? Do you have a zipper?
Why you don't wear
Yeah. Okay, sorry, Dave. I hope that.
You should be wearing
Okay. So we're having uniform issues. Okay. Dave, let me just move your hand down. So, ma'am, I'm just going to assess you now. Okay. I feel pulses. Can you wiggle your toes for me, ma'am? Okay. Without looking, can you tell me what toe I'm touching?
My little toe.
Your little toe. Okay. So I'm happy to tell you you just have a simple femur fracture. Okay, because your nervous system is fine and your pulses are good. All right. So before I move on, I'm just going to look at the femur fracture itself. So this is a closed femur fracture. If it was open, right, the bone is sticking out, broken flesh, I would need to irrigate it. Okay, that's the basic recommendation, is to irrigate it, because when you put traction in, when you apply the traction, the bone goes back into the tissue. And basically the orthopedists want a clean bone going back in, not a dirty one. Okay? And also a management issue, you're going to need towels or a blanket to absorb 1 liter of fluid. Right? You got to be able to do that. Now, if that wasn't the case and it was a closed fracture, and I have abrasions or lacerations, I need to dress it and bandage it before I put on the traction splint, because there's going to be 4 belts going over it, right? So that's going to make the problem even worse unless I protect it. Good. Moving along, I will get my CT6. If I packaged it up correctly, this magical thing happens, right? Okay. So it's extended. They're all connected. So what I want to do is I want to go to the unaffected side. That's the good leg. I need to find this lady's ischial bone or pelvic bone, and here it is. I found it, and I need to match up the top end where the ischial strap is aligned to that bone. Keep it there, go all the way down, and I need 15 centimeters below the foot itself in order to have the space to pull traction. I'm already in the correct position. If she was shorter, I would just remove one of these and bend it down and move the end cap. If she was taller, I would remove this end cap and extend this out, okay? So I've measured it, it's good. Now I'm going to go to the affected side. And before I begin, I will get stuff out of the way. Okay. So now I will remeasure again. I will look for her ischial bone or her pelvic bone. And I found it, and I will match up the end of the cap as a straight line to that. Okay, ma'am. So now I'm going to apply a strap across your groin. And I'm going to be sliding it under your leg. Okay, where am I here? Okay, it's important to keep it flat, because if it twists, another good way to start this is to go under the knee, because there's a space under the knee. And then what you do is you just shimmy it on up, and you communicate with your patient. You say, ma'am, will you tell me how far can I go? Is this good? I'll stop there. Okay, the buckle needs to be on top, because when you close it, you have to be able to adjust it, and you can only adjust it from the buckle when it's on top. Okay, I'm going to pull tension there, and you tell me, when is it enough? Is that enough?
Yeah.
Okay, so that's the top end. Now I go down to the bottom end. I flip the ankle hitch around so that it's on the side of the ankle. Now, right now she's got her pant leg on, but in real life there would be nothing there to be blocking it. So I get the ankle hitch. I make sure that there's plenty of play on the pulley system. Now, the trick here is the ankle hitch is padded, okay, but when you put it on, there is 2 foot straps. Let me see if I can show it. 2 foot straps, and each strap has to be on either side of the foot. So you have to set that up right before you go in, okay? So lead it in this way. This is correct. So you take the foam and you tuck it under, bring it back out. How are my foot straps? My foot straps good, partner?
Mhm.
Okay, then I take the Velcro, I go all the way around, and then you're gonna help me lift. And then the ankle hitch is secured. The next thing I need to do is I need to shorten the foot strap so that there is no play or no space between the strap itself and the foot. So there's no space in here, okay? So now I'm ready to apply minimal traction. So I pull on the pulley rope until I have minimal traction, and then I will put it up on the box cleat and lock it in. I will come back to that later. My partner will continue to hold manual stabilization because now I have to take these 4 anchoring straps and I have to go under the broken thighs themselves. So again, I try to use the space under the knee. I go up, shimmying it up. And you know, this is a socially tacky area, but you know, if your heart's in the right place, you don't have to worry because your patient is going to experience some relief. Okay, then I pull up on the strap and then anchor it in. This needs to be next to the ischial strap, above the fracture site. The next strap is below the fracture site, but it has to be above the kneecap. So you have to palpate the patella so you know where you are. Or if there's nothing there, which is what it should be, you should be able to see it. But if you don't see it, you need to palpate it. Okay, second strap coming on. Okay, I'm just going to pull this down so she's comfortable. Okay, so now I'm at the third strap, and I need to be below the kneecap. So I palpate the patella. I know that this strap is going to be below. I bring this side over, and then pull, and then attach it. 3 straps done. The last one goes above the ankle hitch, directly above. Because you'll see that we need that to contain the excess cord that comes up, okay? So this comes across. And then I pull, and now the 4 straps are attached. Now I go for my final adjustment on the traction. I release the locking mechanism, and now I'll pull traction, and ma'am, you tell me when you feel some relief.
Yeah, that's good.
That's good? Okay. So the 2 things I'm looking for, one is her going from grimacing to pain relief, and the injured foot should be the same length, or approximately the same length as the uninjured foot. That means I've done my job. Now I have excess cord, which can be a hazard. So what I do is I just wrap it up, and I lift the 4th strap without taking it out completely and putting the straps underneath, sealing it off so it's nice and clean. Now the last thing that I do is I do another neurovascular check to make sure that in the process of splinting, I didn't cut off any nerves, arteries, or veins, okay? So I will check her pulse again, and I feel her pulse. Ma'am, can you wiggle your toes for me, please? We have toe movement. Can you tell me which toe I'm touching?
Big toe.
Big toe. Okay. So there is no neurovascular compromise. The splint is in situ. The only other thing I would consider is, you know, I have to look at the mechanism of injury. If she has any other problems because of the significant force that it requires to break the femur bone. If there is evidence of other problems, then we go with C-collar and back mat, right? And then we take her to the hospital. Good?
I'm happy.
Happy, Alicia? Okay, anybody got any questions? Now's the time for questions. Comments? Complaints? It's all taking too long. Huh?
I said I learned too many things.
Oh, okay. Then this was worth it. You can imagine how many new things we learned when we were doing this. We didn't just do this now, right? We practiced this. Okay. I mean, we did do it now, but we practiced it a few times so that we wouldn't look like idiots in front of you guys.
Probably one thing you might need to be aware of, George, is if you are out in the paddock, the Velcro it loves picking up pickles.
Oh my God. We have issues just with the carpet alone.
Yeah.
I tell you.
You can imagine what it's like out in scrub.
I don't want to imagine. But thank you for bringing us into the light. Okay, so check it out. You just fold it back on each other, right? Just keep the straps right there. Fold it back on each other. Keep the straps there. Fold it back. Sorry, I was jumping ahead. Fold it back. Murphy's Law. Okay, and then fold it back one more time, right? And then wrap it, roll it all up. And then it fits into the case, okay? But I'm not going to put it in the case because I'm going to do it one more time. Sir. This is the way we're supposed to do it. Partner, how are you? I'm exhausted. Okay, we've got PPE, and is the scene safe?
I think so.
All right, let's go talk to this guy. David, how are you, sir?
A bit of pain.
Yeah, I bet. I can see you have a femur fracture.
Yeah.
Okay, so I'm George. This is Alicia. Okay, we've got the tools to help you feel less pain and package you up and take you to the hospital. Are you okay with that?
Yes.
Good. Alicia, can you give me some manual stabilization? Shoes off. Okay, I'm just feeling your pulse, sir. You have pulses. Can you wiggle your toes for me? Thank you, sir. Your toes are moving. Can you tell me which toe I'm touching?
Little toe.
Okay. So you've got pulses in your foot, and your motor is good, and your sensory is good. So it looks like it's just a simple fracture here. Okay. So I'm looking at your femur. So it's a closed fracture, okay? If it was an open fracture, I would have to consider irrigating it or washing it with at least a liter of normal saline, and I would make sure I'd have some sheets and towels to absorb all that. If there were just abrasions and lacerations, I would need to dress it and bandage it because of the straps that go on.